Hi, it's a pleasure to be here today at the Asia Healthcare Innovation Summit. My name is Theodoric, the co-founder and CEO of Intellect, Asia's leading and fastest growing mental health care company. Today we're going to speak about mental health care, specifically how we're building modern day mental health care for Asia Pacific, a region that's very nuanced with many stigmas and barriers to its care. In this session, we're going to be focusing quite a bit more on effective mental well-being in the workplace, specifically towards how can organizations and companies drive employee engagement and retention in today's much different landscape of how we live and how we work. Before we jump into the session, a bit of background as to who we are as a company. Intellect today is Asia Pacific's largest and fastest growing mental health benefits company. We serve over 3 million members worldwide on the platform, in over 14 languages and covering live professionals in over 20 countries as well. We have the privilege and honor to serve some of the world's leading multinational companies, local conglomerates, and tech companies that I'm sure we all know and love as well. And importantly, just to highlight, Intellect's not just the largest in coverage and lives covered and extent of how we actually have localized with the region. Intellect's also the largest in terms of venture backing for a tech company in the mental health category, backed by some of the world's leading investors. And last but not least on this piece here, we also invest heavily in our science and our research. As it stands today, we have strong evidence and clinical studies done that actually showcases efficacy across all that we do through Intellect's digital mental health platform. So that's a bit about who we are as a company. I'm going to move on towards today's agenda and what we're going to speak about relating towards mental health and well-being in the workplace. The two key things we're going to cover, the first of it being what are the new challenges and risks of mental health in the workplace, first and foremost. And secondly, what are the newer trends of companies and organizations taking on employee mental well-being today? So the first part here is going to be covering the new challenges and risks of mental health in the workplace. The very key thing to acknowledge first and foremost is that there's been quite rapid change in how all of us has lived and how we work today, from employees to how companies have had to adjust, all the way towards countries and governments as well, on the ways that we live and work and everything in between as well. So we're going to dig into that a bit more. The first thing I'd like to highlight is that mental health and well-being is something that should be viewed from 3 different perspectives and lenses. The first of it is the employee perspective. How do the end individuals in organizations actually face and deal with mental health in these times? The second perspective is how HR teams look at mental health from the lens of the company as well as from the lens of the individual. And last but not least, the third perspective is on how organizations and companies view mental health and well-being today. First and foremost, we're going to touch on the challenges that employees face. 3 simple buckets we have categorized it into. Firstly being well-being, second being productivity, and third being connectedness. All 3 pillars are what challenges and key topics employees actually deal and face with today. The first 2, well-being and productivity, I'm sure it's not new to many of us, but connectedness is actually a key aspect that we cover quite extensively. It's quite a big need that often gets overlooked. So first and foremost with well-being, to highlight the key things we actually highlight from an employee's point of view. First thing is that there are blurred lines between work life and home life, and there's higher chances of burnout from stress and anxiety, different mental challenges, and overall decreased well-being. So that's well-being. The next key thing is on productivity. Naturally, with different challenges that we faced through the pandemic, and now that we have transitioned out of the lockdowns we're facing into a new form of work and how we live, there is impact on how we actually operate. There is lower motivation, morale, and also decreased productivity and output measured across different industries as well. And the last key thing is that there's actually lower connectedness and decreased employee happiness across the board from when we look at different studies run across the region and from our research as well. And this correspondingly affects physical health due to the strain on anyone's mental well-being. So that's the individual perspective. The next is on what HR teams actually face. Across the board, historically, there have been challenges in traditional solutions in the mental space, specifically something called EAPs, right? Crisis helplines. There are low utilization rates. It's difficult to measure because it's just quite hard to quantify. And last but not least, it's a very fragmented space with different solutions tackling different needs, but one that's hard to find a cohesive, integrated solution. So oftentimes HR teams face these different challenges of proving value, measuring outcomes, and having a synergized solution to roll out as well. Last but not least, from the perspective of the organization, right? The top-down perspective of what mental health actually looks like. Over here, there are three main things we've highlighted, pertaining specifically to its higher costs, lower output, as well as higher turnover. Naturally, many of these things come from the different aspects that we just covered, from employees being affected in their well-being, towards challenges that HR teams actually face. These lead to its lower output and higher costs and higher turnover. All of this at this stage today shouldn't be entirely new to what you guys have heard before, but just to highlight that many of these are very real challenges that haven't been addressed or acknowledged on a company level in many cases. We oftentimes see that workforces still believe that mental health isn't a priority, but oftentimes they see a corresponding impact in terms of lower output, lower morale, and overall decrease in employee satisfaction as well. So these are the three key things I'd like to highlight from the lens of the employee, the HR teams that look after the employees, and the companies and organizations as well. What I'd like to highlight here is that people are at the core of any organization. While mental health is still in its early days in Asia, and in terms of how we serve it, in terms of the care provided, I'd like to highlight that if it's not tackled well, poor employee mental well-being will trickle into and affect many other aspects of a company and its business as well, right? Everything starts in the root cause, and people, if anything, are the root of any organization. If they don't feel well, they don't do well, and the companies consequentially will struggle and suffer as well. So it's a key thing that we take this into account in how we actually address and tackle mental health. The next key thing it's on covering, in this session actually, we're going to touch on the newer trends of what companies today are doing to take on mental well-being in this day and age. So I'll be splitting this into two segments very briefly. The first being how to view mental health and the spectrum of care needed. And secondly, what are the new initiatives and solutions that companies today are actually utilizing to tackle employee mental well-being needs. So over here in this slide, it's a very simple phrase and statement here of clinical needs, right? This is actually what we have seen for the most part across Asia and across Asia Pacific, how people receive and views mental health, a clinical crisis need, something that isn't proactive, something that isn't so much so everyday, but more so oftentimes a scarier clinical discussion, clinical need. This, as many of us would know today, is actually not the full perspective of what mental health actually is. Mental health fundamentally is on a spectrum, just like physical health. And I'd like to showcase how that actually looks like. Very simply put, mental health is on a spectrum, and it ranges from a healthy range to things that are more clinical and more severe. Simply put, we've categorized it into three simple buckets, from the healthy range to distress and then the clinical. As we just saw moments earlier, the traditional view of mental health has been clinical all along, looking at things like depression, trauma, severe care that's needed. Those are very important areas to address and tackle, but for the most part, the biggest challenge we see here is that that isn't what most people can actually relate to, which is what we're trying to change. Mental health is a lot more than just clinical need. It also involves everyday struggles that you and I faced, from stress, anxiety, relationship struggles, sleep struggles, insomnia, and more, as well as the healthier state of our mental health, pertaining towards us being resilient, being more productive, being more effective as well. So it crosses different categories, and I like to just highlight that most of us, based on our research, 2/3 of our average workforce in Asia actually falls in the middle category, facing moderate to high stress. And oftentimes it's here that most people do not get the care that they actually require. And the final step on this little segment here is that there was a research study done a few years back in Singapore, which actually showcased that in Singapore specifically, there is a 4 to 7 year treatment gap for mental health, which is a really long time for someone who is struggling with a condition to actually seek care. And oftentimes why this happens is because many of us who are in the earlier buckets, the stress range or the healthy range, neglect and do not seek care when we need it, and it gets pushed towards clinical care when it's much too late. So that's one big thing that we like to change by bringing the purview of mental health from a clinical issue to one that is proactive, preventative, and everyday. That fundamentally is a big shift in perspective in how some of the leading organizations today are viewing mental health and well-being and tackling it from that lens as well. Proactive and preventative, not just clinical. And to showcase as well Intellect, and a big part of what we do is exactly tackling this. Intellect fundamentally, it's an end-to-end mental health care system covering different aspects of needs from the healthy range to the stress to the clinical, all in one centralized platform, digitally available, accessibly anywhere across the APAC region. In one simple mobile app, employees and individuals can get access to self-guided programs, live coaches, as well as certified clinical professionals for mental health needs, all in one platform, as well as supporting organizations in driving insights and initiatives that would tackle mental health and well-being on a population level as well. So these are the key aspect that we like to highlight, that today itself, Intellect services some of the world's leading organizations in providing a cutting-edge form of mental health care that transcends just clinical crisis support through a helpline, which we do cover, but focuses a lot more on proactive care as well. So to summarize and wrap up what I'd like to highlight here, the action we all can take starts with us, right? Mental health isn't just a company initiative, isn't just a government initiative. It's something that everyone plays a role in, from the individual perspective to people managers, all the way towards people leaders, companies, and governments as well. But fundamentally, it starts with us opening up conversations, normalizing how we speak about mental health, and then advocating for solutions in care that actually makes a difference in how we all get mental health support. And that's a big part of what we like to cover today about mental health care in the Asia Pacific region. My name is Theodoric. It's a pleasure to be here speaking with everyone, and enjoy the rest of the summit. Thank you very much.